let's talk a little bit about menopause. And in case you having symptoms, you are not sure, probably this video or discussion will help you to know if you are at that stage of having menopause, or you probably just having symptoms of perimenopause and not really at the stage of menopause. So what really is menopause? Menopause is when women stop having their menstrual cycle, at least for a year, 12 months. And this is usually due to the huge decline of their hormones, mostly estrogen and progesterone. Also, just to clarify a few things, menopause is not a medical condition, neither is it an illness. Menopause is part of, women's life, and about 1/3 of women, once they get to that stage of 50 years, which is the average age for menopause, will do have a cessation of their menstrual cycle. So just to also debunk a little bit of notion out there where people think menopause it's not supposed to happen, and if it does, the way the misconception out there when it comes to that stage is the idea. I want us to kind of try to have a little discussion that menopause is part of life, women's life, and most women, when they get to the age of 50 to 52, will have menopause. However, some women, a certain percentage, I would say a small percentage of women will do experience what we call early menopause, which will be between the age of 40 to 45. A little bit more, a small percentage might have it, maybe under 40 years. That is the cessation of the menstrual cycle, right? However, a few men below the age of 40 might experience erratic, that is inconsistent menstrual cycle. That is below the age of 40. And when this happens, we call it premature ovarian insufficiency. That is where the hormones, are not being produced consistently by the ovaries the way they should, happen. When that happens, you still have your cycle. It's just not consistent. So just to clarify a few things, when that happens, a few women become a little bit worried that are they at the age of menopause. You are not at the age of menopause. It's just that you are not producing, sufficient hormones, and that kind of makes your cycle a little bit, here and there erratic. However, we have what we call perimenopause. So perimenopause again, this happens mostly at the age of between 40 to 45. You still having your cycle though. It's just you start presenting or having symptoms, what we call the vasomotor symptoms, right? So these symptoms, some of them could be the hot flashes, the night sweat, the low mood, the low energy, the mood swings, the vaginal dryness, the painful sexual intercourse, the urinary frequency, right? You do have the symptoms without cessation of your menstrual cycle, right? So that is what we call the perimenopause, right? That is different from when you are menopausal, that is not having your cycle for at least 12 months. So you could be perimenopausal and have these symptoms, and then you could also be menopausal, right, and have the same symptoms. So you could experience these symptoms whether you are perimenopausal, which means that you have your cycle, but for some reason, you're still having these symptoms. And then you could not be having a cycle for 12 months and still have these symptoms. So a little bit of clarity out there. Continue to watch our videos. We'll be having more in-depth discussion about menopause and treatment as well.